Good afternoon, everybody. Welcome to the Night Ministry in 2021. It's a live discussion with Paul Hammond, President and CEO of the Night Ministry. There he is. Thank you for joining us.
Thanks, Burke.
Thank you. My name is Burke Patton. I'm the Communications Manager, and I'm just sitting in. We're waiting for Nieal Marie Ross to join us. So she's running a little bit late, we think. So I'm going to just pinch hit, jump in and get us started so we can get the discussion rolling, because I know all of our times are valuable. So Paul Hammond has more than 30 years of experience working in nonprofit organizations. He has served as president and CEO of the Night Ministry since 2007. Paul provides oversight and fiscal management to all program and development activities at the agency. As president and CEO, he also provides strategic leadership and vision for the Night Ministry, working closely with the organization's board of directors. Hi, Paul.
Hey, Burke. Thank you. Thank you.
Guess what?
What's up?
Nieal is here.
Nieal.
So,
hi, Nieal.
Nieal, hi.
Hi, guys. I thought you had to let me in, Burke. I've been sitting in front of the camera.
Oh, no. We're all ready for you now.
We're on the air and we're rolling, Nieal.
So
All right. Hi, everybody.
This is Nieal Marie Ross. I'm going to let you introduce yourself. I'm going to go away and stick around in the background. I'm going to let you two take over the conversation.
And he already introduced me, so I already said hello to everybody. So.
Okay, well, I'm Nieal Marie Ross, and I'm manager of Youth Supportive Services at the Night Ministry, and I'm going to be serving as the moderator today. And we're going to talk to Paul and, get lots of questions answered and find out about the vision for the Night Ministry for 2021. So I'm excited. Hi, Paul.
Hey, Nieal. So glad to see you. Thanks. Glad you're doing this. Thank you so much.
No problem. Glad to be here. I do have questions, lots of questions for you, but I also want to know, let the audience know that if you do have any questions for Paul, please put them in the comments and we'll get to them a little bit later. So right now we do have some initial questions to get the conversation going. So you ready, Paul?
I'm ready. You know me, Nieal, I can talk forever, so go for it.
You and I both. Okay, so there is some hope on the horizon with the coronavirus vaccines, but COVID-19 is still very much with us. Nearly a year after the pandemic began, we're still dealing with this. So how is the Night Ministry continuing to serve our community members experiencing homelessness or poverty, while protecting the health and safety of our clients, our staff, and our volunteers? What challenges are we facing?
Oh, there's lots of challenges. You're right. The pandemic has been with us for nearly a year now. I was talking with a funder just yesterday, and I said our frontline providers, our nurses, our outreach workers, our workers, our employees in our shelters, this is now a part of daily life. So our staff, our frontline staff, our direct service staff, they're doing emergency work every day, and this has now become a part of what they do. It's not written to their job description, but it's there. And ever since the pandemic began, making sure that the health and the safety of our clients and our staff and our volunteers has been our number one priority. It's kind of really been that nucleus around which all decisions have been made. When the pandemic began as well, we made a firm commitment to saying that our mission's not going to change. Our mission is always to provide housing, healthcare, and human connection. We are not a pandemic organization. We're not a COVID organization, but we are a human services provider, a homeless services provider that now happens to be doing its work in the midst of a pandemic. So we've kept that to be the kind of the kernel of what it is that we do and how we go about doing our work. So it's been a matter of adapting and changing, switching things up a little bit. For a lot of our staff, it's meant having to work from home. or going in to the office or their work location only periodically. For our essential workers, it has meant having to be in full PPE almost every day, day in and day out. We've adapted, as needs have emerged. I remember the very first days of the pandemic, some of our colleagues in our shelters, they realized that youth whom we had served previously and were now housed on their own had lost their jobs in restaurants, and they were now facing food insecurity. So our staff, and the same thing was true with the bus staff on the bus, they realized this was a need on the streets for people who are precariously housed, and immediately switched gears a little bit to seeing how they can better provide for people's food needs and their hunger, taking care of their hunger needs. So we've made those continual shifts as we go along. As we've gone in and out of different stages of quarantine or isolation, our staff have acted accordingly, but it hasn't been easy. Think about our staff on the bus. People who come to our bus, for them, the bus is a place of safety. It's a place of building community. And for our bus staff to have to say, okay, what do you need? Now, sorry, you really can't hang around to talk because we can't have a whole lot of people gathering here. It has ripped people's heart out. It's been really, really challenging. But I know in mid-April, one of our staff members, Keith, came to us and said, when I'm coming to work or going home from work, I'm realizing there's a lot more people writing the CTA because restaurants are closed or they don't have a place to hang out and they're homeless. And can we do something about this? So, and the true night ministry spirit and fashion, our staff got together and said, gee, let's take a look at this. This is a new need. The numbers have increased on the CTA, and throughout the summer provided outreach on the CTA a couple of nights a week. Those initial efforts, which have arisen out of the pandemic, have now resulted in a partnership with the Chicago Department of Public Health and the CTA to provide services at the end stops of, I think it's the red and the blue line, 2 nights a week. We've actually setting up shop there. As people need to leave the trains, then they have access to our services. And last 2 weeks ago was our first full week of this, and we're already serving over 100 people throughout the week. So there's been a great deal of adaptability and flexibility that has been happening, but that doesn't mean that the challenge goes away. We still have to make sure that we keep people safe, keep our clients safe, and make sure that we go about fulfilling our mission in a way that has that safety as the number one priority.
Absolutely. What do you think that the pandemic has taught you about us as an organization, the Night Ministry as an organization?
I will try to keep from crying here.
Me too.
I will say that in 18 years, in my 30 some odd years of doing nonprofit work, close to 30 in leadership, I've never been more proud to be associated with a group of employees, with a group of people, as I have at the Night Ministry this last year. We oftentimes talk about the resilience of those whom we serve, that the people whom we serve are very resilient. But we forget too that our staff are resilient. Our staff are flexible, they're nimble, they're adaptable, they're incredibly sensitive, and they assess and they learn as they go along, and they change as they need to. And that we as an organization too, we can pivot on moment's notice if we need to adapt to the environment that is around us.
Yeah.
And you've seen it in the shelters. I know people finding new ways to do things. And we see it on outreach. And it has just been an incredible journey to be a part of this and to witness it. We have our quarterly all staff meetings, Nieal, and think about since the pandemic has gone on, we have that part of the staff meeting that's called What's Going On, and everyone gets to share what's happening in their area. And just the amount of cross collaboration that started blossoming and people saying, well, gee, gee, I've got this kind of need, and someone says, oh, we've dealt with that already. Let's help you out. And there's just been this cross-pollination of ideas that has just been startling to watch happen, and the benefits it's paid for the people whom we serve has been incredible.
Yeah, I agree. I know that we did a reorg a few years back that was intentional about breaking down the silos across night ministry programs. And I honestly feel like the pandemic has done more to break the silos than anything else could have.
Yeah.
So, yeah.
I've always referred to silos as being cylinders of excellence, and I think that really we've kind of proven that. It's been incredible.
Yeah, I think it's been great, and just the way that people have shown up. Like even myself, like I'm a hypochondriac. This has been horrible for me, but like my heart is here.
Right.
So and I think that a lot of us feel that way here. Most of us feel that way here. So, this is just another hurdle. But I mean, I'm proud of what we've been doing and how we've been doing it. So I think that's awesome. But I will ask, what do we know about the availability of the vaccine for our frontline workers and the Chicagoans living on the street?
Well, we know that right now the list of priority, the prioritization list that the governor released last week, that our frontline workers in the shelters and our outreach teams, they're part of that list. They're part of that list. What we also know too is that those categories for, I think it's called 1B, are incredibly large. It includes teachers. It includes other essential workers. So there's going to be having some work to figure out exactly where our type of staff fall in that. And we're just not quite sure yet. We have been able to get some staff vaccinated through a couple of partner health agencies, and they've been able to get vaccinated because they're medical staff. So that is good. And the more that those type of partnerships we can arrange are great. We're very grateful for that. But like the rest of society, we're just waiting, and it's hard to do that waiting when we're all really so desperate. But I really think, and it pains me to say this, that our frontline workers in our shelters and the outreach staff probably really won't be having access until maybe like the third week of February if we're lucky. And then plus we know also there's continual changes on the distribution priorities and how the vaccine's being distributed that's coming down from on the national side. So, we're in a holding pattern, but we hope it's going to be soon. And we know that those employees have got to be a priority. And I think that like with everything with this vaccine, you start off with this concept or this idea of what's going on day one, and things unfold and things change on a daily basis. And we're monitoring it very, very closely. I was at a meeting this morning where really, it was unfortunately said that there is no plan yet for those who are on the streets, for those who are in the encampments. So that's a concern of ours. We're working with various advocacy organizations to address that, but there just isn't a plan yet, and I'm sorry to say that.
Yeah, I know that just as far as how often things are changing, I'm a part of a group that's doing vaccine education across youth programs, and like we literally have to like recheck our numbers and our facts like every time we do a presentation because it just changes day to day. So the thing is, it's not going to be as long as it's been. So we just have to push through.
They know that. Thank you. That's a great. I love. You've always got such a positive attitude. I love that. What as you're going about doing the work, doing the education in our youth programs, what's been the reaction of the young people whom we serve?
You know what? They are way more receptive to the information and to the idea of getting vaccinated than I originally thought.
Great.
because there are so many, we serve a lot of youth that are, people of color. And, there's been a lot of myths generated that are tied to like the health disparities in the African American community. And, like, are the vaccines being able to like track us and trace what we're doing? And so I really thought coming into this that we were really going to be like having to be like gangbusters on dispelling those myths, but they've been really receptive, and they've asked a lot of questions, and those conversations are going really well. And it's really just about making sure that people are educated so that they can make an informed decision whether or not they want to take the vaccine. And we hope they do. I know I won't. Sign me up. I'd love to.
I'm right behind you.
Sign me up. But yeah, that's our focus, is just to make sure that everybody's educated enough to make an informed decision. So our young people are reacting really well to the vaccine education.
Good. I'm thrilled to know that. That's good. And I do think that, we need to be prepared for the challenge that, are the individuals we work with, the population is very fluid. Some are in and out of shelter. Some will move from encampment to encampment. And, the vaccine is for the most part, the vaccine is a 2-part vaccine. So if we're able to give somebody their first shot, are we able to still have access to them when it comes time to do that all important second round? And we as an organization faced this before many years ago when we were in the early days of HIV testing, when it came time to have to give people their results after 2 weeks, where they're still going to be there. So, we're not unaccustomed to working with people to have to do that intensive follow-up if necessary. But I think that is going to be one challenge that the community faces. But I know that we're ready for it.
Well, we do know that I think what makes me feel really good, because I worry about our young people getting the booster as well.
Right.
And I think that what gives me some sense of calm is that, after the first one, you're like 52% protected, and then the booster gets you up to that 95%. So we do know that at least, if we don't get them to get the booster, that they have that first round of protection. But Paul, you have a really wonderful youth programs team, and
I know.
Aftercare. We have excellent continual care. We have excellent case managers. So one thing we're really good at is finding these young people once they leave our program. And between Bridget Thomas and China and Michelle and Anthony and Brooke and all of our wonderful case managers, Michelle and everybody over at Yacht, I think we'll do a really, really good job.
We can do this. We can definitely do this. Yep. This is what we're good at.
Yep. This is what we do.
Yep. Right.
Okay. So enough COVID talk. Let's talk about really, really, really exciting endeavor that we're entering with flexible housing. So we recently expanded our youth housing programs with the launch of the flexible housing pool in late 2020. Can you tell us about this program, how it works, and how it's different from the other youth housing programs?
Yeah, so a little bit of background information, if I could. So, nightly we operate 61 beds for homeless youth ages 14 to 24, anywhere from overnight emergency shelter to 2 years transition. This endeavor is unique, however, because it's kind of, if you will, avoids the shelter. It helps to avoid the shelter system to get youth into housing. So a couple of years ago, the city of Chicago really taking a look at a lot of data, and this has been borne out nationally as well, that there were a group of adults who were homeless adults who were falling through the cracks of the homeless services system. And these adults were also individuals who were frequently incarcerated or frequently made use of shelters in and out of them, and also to emergency rooms. So working with those three systems really came together to take a look at the data and said, okay, so who are these these high users of the system, and what can we do to be able to get them housed expeditiously instead of having to go through the regular system with waiting lists and assessments and that type of thing. So the city of Chicago set some money aside to provide for more flexible housing that was kind of outside the regular set of rules, the regular box of rules set up by HUD and other types of agencies that said, okay, if we can find these individuals, can we get them housed and keep them housed with supportive services? And those supportive services are oftentimes what a key element that's missing in what we call rapid rehousing programs. It's like, okay, you get somebody into housing, but then where's their support to help them maintain the housing? This approach, this model has been very effective with the adults. So the city said, we want to take a look at doing this for youth, ages 18 to 24. And working with the Center for Housing and Health as the primary leader in this collaborative, the Night Ministry was chosen to conduct the outreach to 60 youth who were identified as being frequent users of shelters, the ER, or frequently increased frequency of involvement with the juvenile justice system. So the idea is to identify these 60 youth, talk with them, go out and find them, talk with them about the program, and then another agency would provide them with the housing, and then the Night Ministry provide the ongoing case management. So this for us is a different type of endeavor. It's not us providing the shelter, but it's us doing outreach, which is what we're really, really good at as well, and finding these young people who are oftentimes hard to find, so we can make them aware of the program. And I think that we were assigned 60 youth on the list. Last I heard, which was this morning, is that 6 of the youth have been found and are now housed. And then we have another 9 youth that we're providing case management to because they were housed to another agency. And we've already identified, I think, over half the individuals on the list and have found them. What's complicating it is that some of the youth have got families, so the system needs to be tweaked a little bit more for that. But this is a different approach for us, as opposed to having youth in shelter. Like I said, it's kind of bypassing the shelters to get them into housing, but recognizing that they need to have those supportive services afterwards, that case management. So what I'm really excited about is this really calls on the best, some of our best skills that we've acquired over 45 years, that is conducting outreach and providing housing. So it also really expands, you mentioned before, our aftercare, our continuing care services. So really recognizing that just because a person has 4 walls around them doesn't necessarily mean that they're no longer homeless. You've got to be able to keep those walls around them so that they don't re-enter homelessness, and provide them with the support, that connection to their community that they need. And again, that connection, that human connection, it's really what the Night Ministry is good at. It's what we do. It's what makes us different. So I'm really excited about this. I think there's a lot of neat opportunity for expansion. We're learning from the work that we're doing. And we're thrilled to be a part of this collaborative with the Center for Housing and Health, City, and other providers. But I think too, we're also doing a lot of what's the possibility? What's the potential for us here for the future to be able to work in different modalities that are still very much in line with our mission.
Yeah, I agree totally. I think one of the main things that kind of had me worried when, we kind of shifted from housing ready to, housing first, was that young people would not be able to sustain housing once they got in, because, they needed more development with the life skills and, just with getting basic things like identification and stuff like that. So knowing that the support that, our case managers and our outreach workers provide, knowing that that's in place, that makes all the difference, because you can't take an 18 or 19-year-old and just kind of throw them in an apartment and expect for them to be okay. It's, people get scared, people get lonely. I often think about when I first started at the night ministry 20 years ago. And
No, don't say that. That makes me feel old.
yeah, when I first started, I got an apartment because you guys paid me enough to get a little apartment. So I got the apartment, and my first night that I was supposed to spend in my apartment, I packed up my book bag and I got on the red line and I went home to my mother's house. I didn't want to, I was uncomfortable. It was something new for me.
Yeah.
So even with all of the, support and life skills and education and everything that I had gained, I was still a young person that needed some extra support.
Right.
So, that's just kind of, how I look at, our young people once they leave. Like we still have to be there and be a force in their lives to help them to, move up the ladder and, realize
towards more independence. Yeah. Well, I think, Nieal, what you're describing really is one of the things that I always talk about is really being the highlight of our approach to our work. We realize that the young adults, the adolescents whom we work with, they are adolescents, and they're going through a crazy time in their life, and put homelessness on top of that. We need to provide our services within that developmental understanding of where our young adults are at. And today's studies show that adolescence goes until age 28. And I think our shelter staff have always been, our youth housing program staff have always been really good about knowing that and understanding that. And I just never forget an example somebody gave me one time from our parenting and pregnancy program. They said, if you've got a 17-year-old mother who's holding a newborn and that baby spits up on them, a 17-year-old is going to take that personally, because that's where they're at in their identity. That's a personal thing. But then we work with youth to help them understand that baby's not doing that to you. The baby's doing that because that's what babies do. And so, or if, a young person talks back, if you will, to one of our staff, we don't condone it, but we try to work with it. But we also know that's what young people do. They push the boundary. They do testing with the adult figures in their life. So going back to, I guess, circling back to what you said, be able to bring this perspective to the youth who are being housed in this program to understand that, they're not just miniature adults, they're youth, but we've got to be able to support them in ways that are appropriate for them to help them make it through. And that's what y'all are good at.
Yep. Thank you.
You are. That's great.
We're led by the best. I just
Dear.
wanted to remind the audience to please, if you have any questions for Paul, to post them in the comments. Paul, let's move on to the endeavor we spoke briefly about earlier with the CTA. So the Night Ministry is partnering with the City of Chicago Department of Public Health to provide outreach to people on public transit. What are we doing exactly at the CTA? Who are we serving, and why are our services needed there?
Yeah. So I think it's important to know two things. We're no longer riding the trains themselves. And we made it very clear to the CTA during discussions early on is that, we're not going to be part of any enforcement activities with regard to getting the homeless off the trains. No. So that's why we set up our work at the end of the stops. The CTA makes anybody who's riding a train get off at the end of the stop. And so that's where there's an influx of people who are maybe waiting around on platforms at the end of a line. And so that's where we're setting up shop. And I think of it, and our staff in the Outreach and Health Ministry program have really taught me to think about it, pretend like we're just like taking our bus to the end of a CTA line. So a lot of it is providing medical screenings, providing some medical care, non-primary medical care, making sure that, if individuals are hungry, we've got sandwiches for them. Making sure, we've got a fantastic case management staff in our outreach and health management team, and making sure that they are there to be able to provide referrals to individuals, do housing assessments, that type of thing. So again, it's taking that the ability to provide for the basic care, those life-saving, those safety net services, and just providing them in a different arena. And it's also too, it's about establishing that relationship with folks. And because we know that those relationships are so important to individuals as they seek to try to make changes in their lives. And what I'm really excited about this at the Night Ministry is it really is combining the work from a couple different areas. We have our street medicine team that's involved with this. We have our bus outreach team that's involved in this, and we also have our youth outreach team involved in this endeavor. So it's a cross collaborative project. But it's largely taking what we do through street medicine and our work on the bus and providing it just in a little bit more of a fixed location for a limited amount of time, a couple times a week.
That's awesome.
Mm-hmm.
My husband, he gets really, his eyes get big when I tell him, like, we're all trying to work ourselves out of a job. Like, I promise we are.
Wouldn't that be wonderful?
That would be awesome.
Yeah. But again, I think too, this really has been a response to a changing need. Like I said before, this came out of something Keith, one of our staff members, noticed at the start of COVID. We're like, okay, what can we do about this? Well, how can we respond to this need that is more prevalent now? And so, and then working with the city through what's needed to do this, and the cooperation that's needed, and the help that's needed, and really defining our roles in it. And I think it's kind of, if I can get a little Pollyanna-ish here, I think it's a neat example of what needs to happen if we're going to really successfully and permanently address homelessness. It's about people recognizing needs and different areas coming together, bringing down some barriers to make services happen.
Absolutely.
Yeah.
It's really exciting. And it's exciting that as an organization, we've built the reputation of being focused on, housing, healthcare, and human connection, to the point where, people want us to do these things. People ask us if, can you guys pilot this? Can you see how this works? It's a nice feeling.
Yeah, it is. It's to me, it means that we're responsive, but it is a source of pride, I think, for all of us, if we're allowed to be proud for a moment. Yeah.
Yep. Yay. Okay. So here's kind of like some of the tough things that we've been through in the past year, especially. It brought a greater call for our country to reckon with racial injustice and inequity. So what can you tell us about the Night Ministry's commitment to the process of becoming an anti-racist organization?
Yeah, thanks. And you're right. These are the tough things. I mean, as if we didn't have enough of everything else on our plate. By all means, the Night Ministry is committed to working around this area, to not working around it, to working with it, and really ensuring that we are an organization that treats people equitably and isn't tinged by racism. Racism takes so many different shapes and forms. There's systemic racism, institutional racism, and personal racism. And I think that we really have a moral obligation, if you will, to examine ourselves as individuals and examine ourselves as an organization to say, okay, how have we been implicitly or explicitly or implicitly contributing to what's going on, to what has happened? And so, and I think it's important that we do this because we know that there are such racial disparities in our homeless population. Of the general population, it's estimated that 13 to 15% of our general population is Black, but 40% of the homeless population is Black. There's something wrong there. That's a result of racist systems at work. And as a homeless services provider, if we're going to be caring about the people whom we serve, it's imperative that we do this work. I have learned so much from our staff over the course of the last 6 to 7 months. And an incredible amount from our staff. It's been humbling. It has not been easy, but we have to take a look at ourselves and along all different lines. And I think that as people who are white leaders, it's incumbent upon us to understand our whiteness, to understand what our privilege has been that has allowed us to be where we're at. That's like a huge area of learning, I think, that needs to be addressed. I know about 8 weeks ago, I was on a webinar for a national board that I sit on. And I talked about the fact that, I grew up what we would consider to be poor these days. I grew up a family of 8, small house, 1 bathroom, free lunches, the whole thing. And talking about that made me realize the difference between barriers and obstacles. I faced barriers in my life. I didn't face obstacles like our staff have, like the people whom we serve have. And that was a real moment of enlightenment for me to understand that, I have no idea what it's like to be a person of color. I have no idea, but what I need to do and what we as leaders need to do in the field and of organizations is to understand how we are impacted by this and how understand how our own position of privilege. And we have a great group of employees that have been working with us internally on this. There are discussions happening. There are some educational opportunities that are happening, all really in the hopes with the goal of getting us ready to be able to take on a more formalized process. But I think one of the things I've come across is this understanding and that, this is not a flip of the switch.
No.
I mean, we're talking about hundreds of years of history.
Yes.
For us as an organization, 45 plus years. This transformation doesn't happen overnight. And this is about a long process, the end of which I may never see. Some of us may never see, but because there's always work to be done. But it is incumbent upon us, though, to do this work. I can remember about 12 years ago, we undertook a concerted effort to take a look at LGBTQ concerns in the agency. We had always been an agency that provided services to that community, but to really examine ourselves and what were our policies like towards and how were our policies negatively impacting this population. We were one of the first organizations in the city to have transgender bathrooms. And I want us to be able to take that commitment that we showed to that process and now be able to apply it to racism and the role of race. We need to make sure that everybody is treated equitably, and we have, like I said, I think I've gotten to the point where, and thanks again to the work our employees are doing and the education I've been through, it's this really for us should be a no-brainer. But yet it is a transformation. It's a journey. There are bumps in the road. We've already discovered some, but we must keep our eye on that end prize. Yes,
yeah, I agree. And just thinking about the initiatives that we've taken with, like, LGBTQ plus competency and like trauma-informed care.
Yeah,
we are like the think tank, in the nonprofit world. I feel like we're, for lack of a better term, tastemakers and, thought leaders. And when I think about how we, degendered the bathrooms and, degendered the rooms and changed our forms and, how we talk to young people when they come into the program to follow kind of like that trauma-informed modality. This is just like the next push. And I'm excited because I've seen what we've done in the past and seen how good we can be at making things equitable.
Yeah.
I'm looking forward to this work that we're doing in the future to become an anti-racist organization.
Yeah. Thank you, Nieal. And I think, I mean, and as we go through this process, I think Philitha Jones Patterson, one of our staff members, is always famous for saying we've got to do it with grace and mercy. There's this is tough work. But it's work that we need that we need to do, and one just doesn't become one. It takes a long time, and we have to be prepared for that. So I think right now we're trying to do a lot of educating. I know for me it's been really important to make sure we're all working with the same concept of what language means before we move forward. So there's a lot of educating and uneducating that needs to be done.
Absolutely.
Yeah.
Awesome. So just to kind of turn the corner a little bit, the move of the administrative office and the crib overnight shelter to 1735 North Ashland last year represented the culmination of serving in the next decade, which was the Night Ministries' last strategic plan. So what's the status of the next strategic plan?
Well, how much time do you have? So you're right. Serving in the next decade was our last strategic plan. The move really kind of was the culmination of it. Right now, we should have probably started strategic planning in January to get ready for our next strategic plan. But it has been so much tremendous change for us as an organization and growth the last several years, and plus throwing the pandemic on top of it. We didn't start on another plan right away because we need to kind of get used to our current way of operating in so many different ways. We have our biggest budget this year that we've ever had before, the biggest budget in the history of the agency. So we need to kind of get used to these clothes that we've grown into, if you will. So over the course of the next 6 months, we are going to be looking for and securing the services of a consulting firm to assist us in developing the next strategic plan. So the goal for the next 6 months, Tracy Rivera, our chief of staff, is going to be heading that process up for us, is to secure that consultancy group, get an internal group of employees and board members together who will act as a task force or planning group around that plan, and then to spend the next fiscal year doing the planning. So that way we can begin to implement our next plan in July of 2023. Hopefully, over the course of the next 6 to 8 months, the world situation will become more clear, hopefully a little bit more stabilized. That will actually provide us with a much more fertile ground for doing some really good, valid planning. In the meanwhile, we're going to be working with a series of 6 and 18-month goals to kind of operationalize things that need to be done. And so that way, when the next plan comes time to implement, we're off and ready to go. But this plan that we've ended now, it took a lot, and our staff are tired, and we just need some time to breathe and to kind of regroup, engage in some self-care as an agency and as individuals, instead of just immediately diving into the next one. So,
and I think that's wonderful to have, like, not only that self-awareness of what we need for ourselves to be able to do the work and move forward, but to have leaders within our organization that recognize that, because burnout can be real. And
it is real, yeah.
And we just want to make sure that we're healthy enough in our minds and in our bodies to show up for the work the way that the people who we serve need us to do. So sometimes it is just taking a breather.
Yeah. Well, thank you. I honestly, I'm not sure how we can push people, but but ultimately, if we as an organization are not settled, are not like you said, breathing and taking care of ourselves, then we are of no good to others who need us.
Nope.
So everything we do is about the clients that we serve, and I think this is yet another way of recognizing that.
Yep. put your oxygen mask on first.
On first, that's right. That's what I always say. Put your oxygen mask first on before the person sitting next to you. That's exactly right.
Yep.
So
That's how we have to do it.
but I guess I just want to say too, that doesn't mean that there's going to be nothing happening over the course of the next 18 months. I mean, we've got a lot of exciting initiatives. We've got a new building that we're working with. We've got the flexible housing pool program, the CTA work. I know there's some innovation going on in the youth housing program. So that doesn't mean that we're sitting still by any means whatsoever. We're trying to take advantage of opportunities, be on the lookout for them. But at the same time, though, kind of putting that mask on too.
Absolutely. Thanks for that.
Yeah.
Thanks for that. Betsy, I hope you heard that.
Well, I think that's one of the really challenging. That's one of the challenging pieces as part of being a part of a dynamic nonprofit. You constantly want to be innovating, constantly want to be changing, but at the same time, you got to take a step back and say, okay, we need to be able to sustain that, and we can't sustain that if, like you said, we're burnt out.
Yeah. Sometimes we just have to sit in what we're doing now, just to acclimate and kind of refocus. So we can move forward.
Right. Deep breaths.
Deep breaths. So Paul, the Night Ministry is wrapping up the $8.7 million campaign for the Night Ministry. How did we do that?
Well, a lot of hard work, a lot of generosity from our supporters, but this was another one of those pillars from serving in the next decade that we're now wrapping up. Nieal, I've said it time and time again, we cannot do the work we do without the help and support of people in our community. And we've got a great team and philanthropic engagement internally, led by Christy Prassis. We worked with some good consultants on this. We've got a great board. We've got incredibly generous donors. So I think we're at this point less than $200,000 to go in the campaign. We've been able to raise these funds over the course of 28 months, and we originally thought that was going to be a 3 to 5 year campaign. I think what this has demonstrated to us, and once again served to remind us exactly how engaged people are with our mission. This campaign was a lot about 1735 and the new administrative offices, and most importantly, the new home for the crib. But it's also been about building for the future. It's been about our endowment and making sure that we have a sustainability fund to help pay for increased costs associated with all the changes that we've gone through. But ultimately, I think it's because I always tell folks, when you've got a great mission, great staff, and great volunteers, and laser focus on the work that you do, it makes things easier in the long run. That's not to say the campaign has been easy. It's one of the reasons where we got to make sure we take a step back and engage in some self-care. But really, we are so fortunate as an organization to have people who are highly engaged in our work and care about the outcomes that we're able to demonstrate, and that we have an impact. And I think that the campaign has been able to demonstrate that, and we are so grateful for the gifts, that have ranged in all different types of sizes, because they've all helped to make a difference.
It's definitely a collaborative effort, and not only for the staff, but for our supporters.
Yes.
So, my tagline on NightNet, which is our kind of intranet system, excellence is the standard.
Yeah.
And I think that's true for the Night Ministry. Like, excellence is the standard. Like, what we do, we make a point of doing it well. We're methodical in how we vet, folks to come on board and be a part of the Night Ministry. We're methodical in, picking our volunteers and making sure that they have understanding of what it is that we do and who we serve. I mean, we put a lot of thought into all of that. And I think that just kind of, it breeds
Yeah,
excellence.
it does. Yes.
We
And it produces results.
Mm-hmm.
Yeah, and it produces results. And that's the most important piece of our work.
Yes, absolutely. So Paul, you talked with the Night Ministry staff recently about expanding the concept of philanthropy. I loved this activity that you did with us in the last all staff meeting. You had us all kind of say what we thought when we heard the word philanthropy, what philanthropy means to us. And a lot of people responded with like money, and fiduciary like situations.
Right.
But we're pivoting that, and kind of rethinking philanthropy. So when you hear, when a lot of people hear the word philanthropy, of course, they think about the giving money and raising. So how are you encouraging us to think more widely about what philanthropy means?
Right. Yeah. So it's been fun. And, Nieal, I'm going to push back a little bit. I don't think that really we're pivoting. I think that really what we're doing is naming something that's been going on for a long, long time.
Yeah.
This is nothing. I don't think this is anything new for us. Philanthropy, like you said, everybody normally thinks of the financial transaction, but philanthropy really is about people being engaged with a cause that helps to change lives or to have an impact. And that's just not people who donate to us financially. That is a volunteer who donates of their time. They're engaged with us. Volunteers are philanthropists. Individuals who drop off socks for us, or sleeping bags, or lotion, or shampoos. They're philanthropists. They're engaged with our mission, and they're going to have a positive impact on those whom we serve. A fifth grader who goes to school, instead of when they have a birthday party, they tell their parents, "I don't want people to bring me gifts. I want to bring blankets for the night ministry." That fifth grader is a philanthropist, and we all have a role. We all have a role in engaging that. People think of philanthropy as being a transaction, but ultimately philanthropy is about education. It's about engagement. It's about putting that mission at the heart of what you do. And again, I don't think this is new for us. I'm just kind of really formally now naming what it is we've been doing. Our custodians who keep our facilities in such incredibly pristine condition because they believe that that's what our clients deserve. People who come through, they see that. That's part of the philanthropic engagement. So many of our staff members, before COVID hit, they're like, when are we going to have another tour? When are we going to have more people out? They love leading that. They love that educational process and being involved in that. And all of that is about engagement. All of that is about different ways of engaging people with our mission. When our staff and they go to a corporation for lunch, again, different times, and we will get back to it, and people put together hygiene kits and we talk with them about our work. That's philanthropy. And everybody at the Night Ministry plays a role in that philanthropic process, that engagement process. So, and again, I think this is something that we've known for a long time. I think we're just kind of really finally naming it. So that is what that's what we're about. But and the one thing that has always impressed me about the Night Ministry from day one is that we take this relationship piece seriously. Not only do we do it with those whom we serve, we do it with our staff members, we do it with our vendors, we do it with the general public. And that relationship process is at that core of that philanthropic process, of that engagement process. And that's what our staff are good at. That's what our board is good at. That's what our volunteers are good at. So, we're all philanthropists.
I agree. I think that it's important for people to know that it doesn't cost a dime. It doesn't have to.
Right. It costs. It's having your heart there. It's being open to being educated, and allowing that education to take hold and to move you to to want to make a difference. I don't care if it's with the night ministry or not, but be able to be engaged with a mission somewhere where you have a positive impact on the lives of those who are in your community.
Absolutely. I agree wholeheartedly.
Cool.
Paul, we do have some questions.
Okay. We got a couple minutes yet? That's great.
Yep, we got a couple minutes. We had a question from Anna, who wanted to know if there were any heartwarming stories from the community members that we've heard in the last year. That
from those whom we serve.
Mm-hmm.
Yeah, I mean, oh my gosh, and that's one of the things I love about our all staff meeting, because it's a chance to really share those stories. So I think about it is the individual whom our street medicine team is out working with in an encampment, and that person has been so burned by society that for them isolation is the only way that they can live. And then we've seen this time and time again this past year, that in the midst of this danger from the pandemic, our staff are establishing that relationship where individuals end up getting into housing. You all do it in youth housing programs as well. It is about the young person who, despite everything that's crazy going on in the world, is saving up money to be able to move into their next housing, next stage housing. I think that when I think about stories, is everybody's story is different.
Mm-hmm.
And sometimes it's a person coming back to the bus for a second visit. That's success, and that's heartwarming. Mm-hmm. Because that person maybe has never trusted anyone in a long time, and they're telling us that they trust us. Or it is that young person in the shelter who decides to get up and leave one afternoon without telling us, because of course they know best, because they're teenagers. And then it is our shelter, them coming back 3 weeks later, and our shelter staff welcoming them with open arms. Yep. It's not why did you leave? Mm-hmm. It's welcome back.
Welcome back.
And for that young person, that again is that trust. Mm-hmm. It is that willingness to work with us. That's like the greatest gift you can get.
Absolutely. Don't I know it?
It truly, truly, truly is. We've had those situations where our staff on the street, we have to call the emergency squad because somebody's health is not that great. And I know our staff is out there saving lives. It's these things that we're doing that make a difference, and realizing that for each individual person, that success looks different in what they do.
Absolutely. Well, we did have some more questions, but Stefan has been helping out in the chats. So
Stefan's one of our nurses, for anybody who doesn't know. Thank you, Stefan.
So with that being said, it's time to wrap up today's program.
Oh dear.
Thank you so much to Paul. Thank you, Paul.
Thank you, Nieal. Thank you. I was looking forward to this all day long. This is so much. You do great. Thank you.
No, me too. Oh my God, you don't even know what time I woke up this morning. You know what? I just said I'm not even going to bed because I'm not trying to set myself up for failure.
No, it's been a pleasure. And to all of our supporters and our friends who are out there listening and tuning into this, thank you for engaging with us. Thank you for wanting to learn more about what's going on in the homeless services provision in the world. Thank you for wanting to learn more about the night ministry. And hopefully you've had a chance to get to know, either through stories or hearing Nieal talk, about our wonderful staff who make who do out there doing the work on the front lines. So to anybody who tuned in, thank you very, 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 very much for being engaged with our mission, because you do make a difference in our community, and we're most grateful for for your time this afternoon. Thank you.
Yeah, thank you so much.
Great.
Awesome.
Yay.
Yeah.